Hello, my name is Allison Rupp, and I shadowed Mackenzie Mangles, a physical therapist at UK Chandler Hospital, and I shadowed her yesterday morning, and I really enjoyed my time following her around because physical therapy is something I don't really have any experience with and very little knowledge of. So I enjoyed getting insight into what she does. I saw her travel around the hospital to various units and see many different types of patients, work with many physicians, and she worked very closely with an occupational therapist. And something I learned and I found interesting was just how closely she works with the occupational therapist team. I knew that physical therapy and occupational therapy were closely intertwined in a patient's recovery, but I didn't quite know how closely they work in the sense of she worked with this therapist the whole time I was with her as well. And they together worked with the patient to fit the patient's specific needs. So I found that very interesting. During my time with the physical therapist, I did observe nurses as well, and I thought it was really cool to see what a nurse looks like from an outside perspective. I watched the nurses work with their patients and I saw them charting, which I know the background to that and everything that actually goes into that. So it was very interesting to see it from the different angle of the physical therapist, which is something like, oh, I need to tell the nurse to be careful moving this patient here. And when we would think about how we needed to communicate with the nurse on the physical therapy side, I found myself thinking as well about all the things that nurse deals with and all the patients that nurse has, simply because I have that inside perspective with the nurse because that's what I see in clinical. So I really enjoyed the interprofessional collaboration aspect of everything the physical therapist demonstrated to me. I watched her communicate with obviously the occupational therapist, the healthcare provider, the nurses, the entire medical team, and the case managers, especially in terms of where people need to go to get the proper rehabilitation they need to recover. And I thought it was very good. It went well. The physical therapist I shadowed was incredibly skilled in collaboration and really working as a team with all of these parts. So I found it very competent and very patient centered, as was pretty much everything she did throughout my shadowing experience. So I had a very good experience and I really enjoyed my time getting to see how a physical therapist works in the hospital, which is much different to obviously what I've been seeing with my nurses on the floor throughout my clinical. And yeah, I very much enjoyed my experience.